Hello, I'm Dr. Sundari Mase, Sonoma County's health officer, and here is our update on COVID-19 cases as of September 8th. We now have 6,488 confirmed cases in Sonoma County. That includes 2,043 active cases, 4,347 recovered cases, and we now have a total of 98 deaths with no reported deaths in the previous 24 hours. We have now performed close to 107,500 coronavirus tests in our county, an increase of 1,076 tests in the last 24 hours. With recent fires and power outages and record-setting heat waves grabbing our attention over the last few weeks, it can feel natural to put some things in our lives on the back burner. But it's important to remember that we can't put off our response to COVID-19. It doesn't sleep or wait or go away just because we're responding to other issues, even when there are serious issues. It's this simple. When we don't pay attention to the novel coronavirus by practicing our safe habits, mitigation measures, safe behaviors, COVID-19 spreads more rapidly and causes more sickness and the potential for very serious consequences. That's why we want to remind you to wear the face coverings when you're outside your home or with anyone from outside your household, to maintain the 6 feet of physical or social distance from anyone outside your household, to wash your hands frequently for 20 seconds with soap and water or use hand sanitizer, and don't socialize in groups outside of your family. As groups grow in size, it becomes difficult to manage the behavior of everyone, and remember to keep it small, keep it safe, and keep it to your household. Unfortunately, we still have months of fire season ahead of us, and we need to do all that we can to lower transmission rates, even if we have to evacuate or stay indoors because of smoke. This is going to require planning on your part. So carry your face covering with you at all times when you leave the house, even when you think you will be able to stay socially distanced from other people. You never know when you may be in a situation where you are within 6 feet of other people that are not part of your household. Also, carry hand sanitizer with you when you're out in public. Hand hygiene is critical, and you may not be able to always find soap and water. Have a go bag ready in case you need to evacuate quickly. Learn more about what to put in your go bag at socoemergency.org. In the event you must evacuate, we don't recommend staying with family or friends who are not part of your household, but we do understand that this may be unavoidable. So we suggest that you build a plan now to stay somewhere where your household members may stay together with their own bedroom and bathroom, if possible. Try not to share food, plates, bowls, utensils. Wear your face coverings when you're in common rooms with other people outside of your household. So today we have a community question. Why is it better to socialize outside rather than inside? That is a great question. With the recent smoky skies, we want to remind everyone to keep an eye on air quality. The AQI has been particularly high. Even today, it was over 150. Try to limit your time outdoors if the air quality is poor. Even when the air is clean, people should avoid gathering in groups, whether inside or outside. However, as the question suggests, spending time outside may lower the risk of spreading COVID-19 when compared to being indoors. This is because COVID-19 is mostly spread through the respiratory route, that is, respiratory droplets that are produced when someone with the virus coughs, sneezes, talks, or even laughs. When you're outside, the air circulates in open space, and the droplets can't accumulate in a confined area. Because of this, when you're standing next to someone outside, there's a smaller chance that you will breathe in these droplets. They may disperse more quickly. That said, it remains critical for you to wear a face covering, maintain the 6 feet of distance, and wash your hands frequently when you're socializing with people who are not part of your immediate household, even when you're outside. We also ask that you keep groups small and really limit to your household whenever possible. So that's the end of my presentation for today. Stay safe. Thank you for joining us, and we'll talk again soon.